today, Honorable Chairman, and ladies and gentlemen. I'm glad to here to present the topic. I comes from Taiwan. My name is Cai. You can call me Joseph. My topic, we are talking about the quality improvement of healthcare by education for postgraduate year of Chinese medical doctors. It's a training program. The main point I will talk about is first, the introduction to the print chart. 3, the achievement. 4, the conclusion. Before we come to discussion this topic, there must be a question. Why? Why Chinese medical postgraduate year training program? Why launch? So to answer the question, we should come back to the 1999 when I was a young resident. It's such a good old day, but in the training course there always be many questions to ask, and there's so many suffering. So there is so many disadvantages of apprenticeship, 师徒制. First, there's non-comprehensiveness, which is limited by the experience of the mentor and the clinical environment. Second, the inheritance of the bad habit and the culture. Third, the separation of the creativity and the thinking. According to the learning period, we can say that, we can see this. The demonstration, the retention rate of demonstration is just 30%, while the practice by doing is 75%, which is the core value of resident training. So there's obviously a need to change from the apprenticeship to resident training. In order to achieve the goals, the Ministry of Health and Welfare began to design a program which can by teaching and assessing the ACGME core competency to use in the Chinese medical doctors. So I'm going to the training chart of the establishment of clinical training system for TCM doctors. If you has not forget that I have mentioned before, in the year of 2002, I have become a chief resident, which just these programs, the root of this program to print it the same year, 2002. And till now, it has been 16 years. So there are 3 stages of establishing the training program. First, to establish the environment. That's just I say the root should be planted. Second, the implementation of the Chinese medical PGY training program. And the third is what we are going to do is to establishing the training program of Chinese medical specialist system. What we do is just want to improve the quality of health care by ensuring and improving the quality of TCM resident training. So let's come to the second part, the print chart. So the Ministry of Healthcare and Welfare launched this program to institutionalization and improving the quality of clinical training system. And in 2009 is the year to formally launch promotion of TCM PGY training program. And until 2014, there's a law which regulates that every physician who wants to be a responsible doctor of the clinic must be to pass this program. So we go to the achievement of this TCM PGY training. The TCM consultation teaching is one of the best ways to integrate Chinese and Western medicine. The second way of teaching is the CM OPD teaching. It was the most traditional way of training, and it's improved by adding a new method of clinical assessment tool, mini CX. And the following method of assessing our student is the training through CM OSCE, which the skill and the attitude can be assessed and taught through CM OSCE. And we apply the tops of clinical skills. The top of clinical skills has been adapted to training acupuncture and traumatology specialty, because the core competence of these two specialty will be skills. And every training was requested to attend the regional and nationwide case reporter workshop annually. It's a very interesting workshop which you can gather your residents and your teachers from everywhere to discuss how to make your case report better. And we adapt the accreditation of CMPGY program. Through the annual accreditation of CMPGY program, the quality of training has been improved and sustained. Through this program, we can see the number of hospitals who adopt this program comes from 2009 from 10 to 65 in the 2018, while the training, the number of trainings comes from 32 of 2009 to 564 to 2018, and the training ratio comes from 6 to 57%. We can see there's a tremendous increasing number of trainees from 32 to 564, and a tremendous increasing number of main training hospital from 10 to 65 hospital. To prove the improvement of healthcare ability, we have assessed this student who accept this program before and after in a 1 year period. You can see there's a first year of resident in green, and the second resident level as purple. There's a very obvious increase of the score of OSCE. So we came to the conclusion. There is very good and special things happens in Chinese medical PGY program. One, first, the adoption of useful methods such as OSCE, DOS, Minicius, 360-degree evaluation, case-based discussion to Chinese medical training, clinical training. Second, the institutionalization of the clinical professional education of Chinese medical doctors. Third, the sharing of core value and the valuable concepts of modern medical education of the resident. So through this effort, let me remind me to there's a famous saying which is said by the Li Chen, is a former chairman of Chinese Medical University, which is my alma mater, my mother school. It said there is no difference between Chinese and Western medicine during treatment. The most important thing of learning is the comprehension of the core value. Thank you. It's my speech.
Thank you. Thank you, Dr. Tsai.